Hello, my name is Sokratis Nifakos, and I am a researcher in health informatics at Karolinska Institutet. I'm conducting my PhD right now in health informatics, and I have been working in COE since 2013 in several EU and national funded projects around e-health. When one of them is COVIDX. When the pandemic started, it was a need from the European Commission for a common action for COVID management, for developing of new tools, for better management of the pandemic. So we are working in this field, in e-health. So we were driving actually the idea of conducting something around the development of technical tools and the application within this pandemic management. This call, it was really interesting because it was this kind of urgent calls from European Commission, and we were able to collaborate with SMEs that they had already developed solutions, and we were able to bring them together with the healthcare organizations, the hospitals, and the research institutes. So that was the reason we joined this common action together with the other partners in COVIDX consortium. So far, we have gained a lot of knowledge about AI tools and the applicability within the healthcare sector and the pandemic management. We have seen the barriers and the ethical issues we have, and also, when it comes to this kind of urgent management, the pandemic management, we see how we boosted a little bit these AI tools in order to be faster implemented and to get better results within healthcare sector. Also, we kind of exchange knowledge between the different countries, organizations, and SMEs. We provided our experience within this field, and I think one of the biggest advantages of this project is that we, from the research side and also from the healthcare side, we came closer with the SMEs. So we had a good communication channel between us, and I think it was because of this situation, the urgency of the pandemic management. I would say that the collaboration with companies around healthcare, it's I mean, we enhanced this through this program. So we got the lessons learned from their side, and they got the lessons learned from our side. And I think this is a very good opportunity for SMEs to come closer to the healthcare sector and understand better the challenges we have there, and also to come closer with the research institutes. So we have kind of like a triangle of collaboration between SMEs, the healthcare organizations, and the research institutes. And I think this program gave us this opportunity to come closer, unfortunately under this condition of pandemic. But yeah, that's I think it was it's a very good opportunity to create this kind of framework of ecosystem. So we have the SMEs closer to the healthcare sector and to the academia. I think it's the healthcare organizations, they have the opportunity to get better understanding and well-developed tools, artificial intelligence tools, data analytics tools, diagnostic tools. So they have already developed and they can be tested in their premises. So this is something that it was a barrier. It's a challenge in the healthcare sector where we can see the challenges, but we don't have the funding and the resources in order to develop these technologies. So when it comes to the collaboration with these SMEs, we get the tools and we have a very good dynamic. So we can easily test something in the real setting. I would like also to add here that the collaboration with the SMEs and the healthcare sector and the academia, it gave us the opportunity to have an easier access to data. Before it was not so easy before the pandemic. So now, I mean, there is a strong collaboration in this program. So the SMEs, they have access to data, and the healthcare organizations, they can analyze better their data with the tools that we have available in the COVIDX program. The overall impact of the project is that, as I mentioned, this collaboration between SMEs, academia, and the healthcare sector. We have tested, evaluated AI tools. We have seen new challenges. We are trying actually actively to enhance these collaborations we have in this program. I would say that we are not in very mature level when it comes to the applicability of AI tools in the healthcare sector for different reasons. But through these programs, as COVIDX, we can see that if we have strong collaborations between these three different entities, we can achieve better results faster, and to provide tools for improving the healthcare sector and improving the health of our citizens in Europe.